Hi, my name is Kara and I'm a nursing student at the University of Connecticut in the United States. I'm here to talk to you about basic management of bleeding and wound care. If you are ever put in a situation where someone in your care needs to be treated for a wound or bleeding, the accident most likely did not happen right in front of you. If someone is injured, the first thing you want to do is put pressure on the area that is bleeding. This will contain the amount of blood that is lost and also prevent shock related to a large amount of blood loss. Loss of more than a quart of blood is a threat to the person's survival. It is critical to stop the bleeding as fast as possible. Try to find something as clean as possible to wrap up the wound with and tie it tight. The best option would be a clean towel or a piece of fabric. It is also important to note that we can stop the bleeding more effectively if the supplying artery has pressure applied to it as well. If we can slow the bleeding from that artery to the site of the injury, this will slow the bleeding overall. I mentioned that it is ideal that the supplies used to wrap around the skin is clean. This is because the skin is the body's first defense against germs that may cause infection, so when the skin is broken, it is really important to stay clean and free of germs. Using supplies that are as clean as possible is essential to preventing infection. If the blood loss is coming from the patient's arm or leg, raise that body part above the heart to slow the bleeding. Anyone with a large amount of blood loss, injured with a dirty object, or has a penetrating foreign object from their wound should be instructed to go to the clinic for further health care to prevent infection. If the wound is superficial, such as a scrape or small cut, you might not have to seek health care. You can put pressure on it to stop the bleeding, rinse it off in water, and wrap it in something clean and dry. For small wounds, only seek health care if it becomes infected, which we will talk about later. It is also important to note that the penetrating objects should be stabilized in place until they reach a healthcare provider. This can be done by wrapping several towels and blankets around the penetrating object. The penetrating object should be supported upright. If it is large and in deeper layers of the skin, it is important to seek out a doctor at a hospital, as removing the object can cause more injury, resulting in even more bleeding. So, now that we have a situation where a person is injured, bleeding, or both, and they are now at the clinic, make sure the patient explains exactly what happened so you can treat them correctly. For example, if the patient was bit by an animal or another human, this indicates a high risk for an infection, so we must be extra cautious. Another reason to know what happened is that knowing how the patient got the wound in the first place will tell you if you should be looking for anything inside the wound like wood, glass, or other debris. Next, hand hygiene should be performed. It is our job as healthcare professionals to always maintain standard precautions when giving care to our patients. Standard precautions means that every patient should be treated as clean as possible. In this case, the best thing we can do for them is wash our hands. This will aid in preventing any infection that is possible from treating an open break in the skin. It is also important to remember that since you will be coming into contact with bodily fluids of another person, you should be wearing gloves if they are available. You don't know what kind of germs are in the other person's blood, such as malaria or HIV. If you happen to have a small break in your skin as well, you could come into contact with those diseases through the patient's blood and become infected. So, it is important that you wear gloves and wash your hands when providing care to these patients. You should also never share needles or any other type of supplies from patient to patient. This is another great way to stop the spread of disease from person to person. I know it may seem urgent to care for the patient with a wound right away, but this is an important step in protecting both you and the patient from infection. After the bleeding has slowed down, we need to remember that there are still germs, dirt, and other debris that are in the wound that need to be washed out before it can be wrapped and bandaged. A common misconception is that you should wash out the wound with hydrogen peroxide or another antibacterial substance. The truth is that these can irritate the wound and damage the surrounding skin. It is actually best to rinse out the wound with normal saline if that is available to you, and if it's not, tap water is okay. The goal of the wound irrigation is to remove the debris and germs with as little chemical and mechanical force as possible. The wound should be rinsed on its side from cleaner part of the wound to dirtier part of the wound. This allows the clean part of the wound to stay clean, resulting in better prevention of infection. The person should also be lying on their side so that the water will rinse off their body onto a towel. The wound should be rinsed until the water running down of the wound is mostly clear. Rinsing the water down the wound is called irrigation. After the wound is irrigated, any remaining foreign objects should then be removed. Removing the objects might cause more damage and pain to the patient. However, leaving any foreign object in place increases the risk of infection and prolongs wound healing. The best way to remove the object is with tweezers that have been sterilized over a fire or boiling water. If available, ice should be applied to the wound area to slow the bleeding and swelling even farther and provide pain relief for the patient. After the wound is irrigated and cleaned, hand hygiene should be done again. The wound is dirty, and you should protect yourself as well as the patient by washing your hands after irrigating and cleaning the wound. The dressing you provide to the patient should be as clean as possible, and if your hands are dirty, this increases the risk for infection. After the second performance of washing your hands, the next step is to dress the wound. A dressing should always be applied. You should then decide whether you will give the wound a moist or a dry healing environment. A good rule of thumb is that if the wound is dry, you use a moist dressing, and if the wound is wet, you would use a dry dressing. A wet wound is a wound with drainage. A dry wound is a wound that has minimal drainage and bleeding. Like I mentioned previously, anything superficial on the skin is okay to clean and bandage the wound only. If you are going to give the patient a moist dressing, the best way to do this is to soak the sterile gauze in saline or tap water and squeeze out excess moisture. It can then be directly applied to the site of injury. Loosely pack the wound with this gauze until the surfaces and edges are covered. Ensure that all wound surfaces are covered and kept moist. If necessary, you can use sterilized tweezers like I mentioned before to apply the gauze into all wound surfaces. If you are going to give the patient a dry dressing, pat the area dry using a gauze sponge after cleaning and irrigation. Then apply a dry layer of sterile dressing over the wound. You can use the sterile tweezers to do this as well if you have them available. Next, you can apply dry but sterile gauze pads over the gauze. This will help keep the gauze in place. Tape can be used over the gauze pads to secure the dressing. If the tape is not available, wrap the wound over the previously applied pad with a gauze roll to keep it in place. Tuck it in to keep it from unrolling. Then you can remove your gloves and perform hand hygiene again to protect yourself from anything you might have been exposed to while applying the dressing.